I'm Adolfo Rubinstein, Director of the Center for Implementation and Innovation in Health Policies at the Institute for Clinical Effectiveness and Health Policy in Buenos Aires, Argentina. I am a physician and epidemiologist and former Minister of Health Argentina. As a researcher, I have an extensive background in implementation science and policy research. The article I will talk about is Lives versus Livelihoods, the epidemiological, social, and economic impact of COVID-19 in Latin America and the Caribbean. As you may know, our region had one of the highest COVID-19 death toll worldwide, despite stringent mobility restrictions that triggered large economic losses. Mobility restrictions policies such as lockdowns and non-essential business closures implemented early in the pandemic had impacts on workers to the drastic reduction of working hours that were difficult to sustain over the long term. Built on a previous epidemiological model, we developed an integrated econ model for Argentina, Brazil, Jamaica, and Mexico. In addition, we accounted for the impact of different policy measures on gender and income gap along the year 2021, because that year produced the highest death toll in the region. This study measures the epidemiological and economic trade-offs to evaluate how the mitigation policies adopted by governments affected the trajectory of the pandemic and the economy as a whole, using metrics such as death, hospitalizations, and GDP loss, and the distribution and impact according to sex and income level of the policy measures implemented, taking into account the vaccination rollout. Our integrated model accounts for lockdown fatigue also, a concept that helps explain why stringent lockdowns were unable to curb cases and deaths. In regards to the main results, among the countries, Argentina and Mexico displayed a higher GDP loss and a lower mortality rate compared with Brazil and Jamaica. The magnitude of the trade-off differ across countries. For example, reducing the GDP loss at the margin by 1% would increase the daily mortality rate by 0.5 per million in Argentina, but only 0.3 per million in Brazil. We also observed an increase in poverty rates related to the stringency of public health and social measures. However, no significant income loss difference by sex were observed. Our results indicate that the economic impact was uneven across countries as a result of different pandemic trajectories, mobility and public health measures, and vaccination uptake, as well as health system and socio-economic difference and fiscal responses. Policymakers in low and middle income countries need to be informed about this trade-off to make strategic decisions to save lives and livelihood should another epidemic or pandemic arise. Thank you.